As most Americans wait to get the COVID vaccine, we're learning about accusations that some wealthy and well-connected people are trying to cut the line. In Florida, officials are investigating reports that a luxury assisted living facility offered and vaccinated its board members and wealthy donors out of turn. Well, Manuel Bojorquez is at a vaccine distribution site in Miami Gardens with more on the story. Good morning to you, Manuel. We can see the cars lining up already.
That's right. So you know the saying, money talks. Well, we should point out that states are trying to clamp down on improper distribution. But the reports of people skipping the line come, as you note, people here waiting in long lines for the vaccine. There are people dealing with registration websites that keep failing, or phone lines that are jammed, or are essential workers who are not part of the first round of shots.
For those teachers that are not virtual, they should have a priority to vaccinate.
Miami teacher Carla Hernandez-Matz is the president of the largest teachers union in the southeastern United States. Teachers currently under 65 are not eligible to get the vaccine in Florida, and it's unclear when they will be.
Just as essential workers like firefighters and police are being prioritized, so should have teachers.
It's up to individual states to determine who gets the vaccine and when. The frustration comes amid reports some wealthy Americans are trying to get vaccinated before they are eligible, and in some cases may have been successful. A state and federal investigation is underway after Morse Life Health System in West Palm Beach, Florida, was accused of giving vaccines to its rich donors who do not live at its assisted living facility. It was reportedly organized by two New York real estate moguls on the board of directors.
You have basically given the vaccine to hundreds and hundreds of different private providers, and you're trusting that they're going to do the right thing.
State Representative Omari Hardy oversees the district where Morse Life Health is located.
It just goes to show that there's been one pandemic for the rich, and there's been another pandemic for the rest of us who are not rich and well connected.
I have an acquaintance who was able to just log on the New Jersey site, who's not a high-risk person, and go get a vaccine.
Dr. Edward Goldberg is a concierge doctor in New York City. That means his patients pay him a fee of $20,000 a year, which covers their personalized care.
It's really more people who aren't my existing patients. I'm getting a lot of phone calls from people like, you're a concierge doctor. I will join if you will come to my home and give me a COVID vaccine.
What do you tell them?
What I tell people is if they are part of my practice, I will let them know immediately when they're eligible, but I really don't have the ability to adjust the waiting list.
People are just used to being able to get their way when they have privilege and wealth.
Last month, CBS News spoke with Beverly Hills doctor Ehsan Ali, who told us several dozen people offered to pay him to cut the vaccine line. He told them no. Now he says he's been hearing of people getting the vaccine through their hospital or government connections.
People are willing to do what it takes to get this vaccine.
In California, the state medical board recently warned that providers who do not properly distribute and administer the vaccine could have their license revoked. Earlier this month, New York Governor Andrew Cuomo also said he planned to introduce legislation that would make it a crime to help someone skip the vaccine line.
People of means are used to being able to get their hands on that resource by paying more money.
Holly Fernandez-Lynch is an assistant professor of medical ethics at the University of Pennsylvania. She pointed out the wealthy often have more means to protect against COVID.
People who are most vulnerable to COVID are racial and ethnic minorities, and it has nothing to do with, biology or genetics or any of that. It has to do with how those features correlate with other types of inequity in our country in terms of what types of jobs people have, where people are living.
Is our healthcare system set up where clearly it's an advantage to have money when it comes to prioritizing yourself?
Certainly. The vaccine is one teeny tiny example of that. This is just one tiny microcosm of the really, really disturbing inequity that we see in the American healthcare system.
We reached out to Morse Life, the facility in West Palm Beach, as well as a representative of the two real estate moguls who are accused of helping their wealthy friends get the vaccine. So far, we have not heard back from either. Tony?
All right, Manny, thank you very much. No additional comments. Next, Vlad, do you do?
No. I mean, I just think it's very scary because everybody wants it.
Yes. You know,
and they're trying to work out the system so that everybody can get it equitably.
Everybody should be part of a wealthy and well-connected entity called the United States government, and they should be taking care of us on this front. And hospitals who want to take money to give things out early should resist that urge.
Yeah, nobody I know thinks that's a good idea.
No, it's a bad idea.
When you're not qualified.
Agreed. We have consensus.